Excitement, sadness, anticipation, fear, anxiety, joy. This time of year is filled with so much emotion. Summer ending, kids have a new school year ahead of them. And no matter what the age, for both the students and the parents, this can lead to some real stress. The doctor's in to help all of us get through it.
Just like life, school can be both very rewarding and very challenging, with so many competing demands.
But there are a lot of potential stressors that can occur throughout the year. One is peer stress and social stressors of just adapting to the day-to-day, and that can include bullying, involvement in romantic relationships, relationships on the sports field or in extracurriculars. There's also the academics that you're managing and the pressures that we set internally, as well as families sometimes set, and that our society sometimes sets.
That all adds up to a lot. Nesu Malice, a child psychiatrist at University of Michigan Health, says that's why it's so important to start the conversation now, recognizing what kids might be thinking.
It can be really hard to reassure children and adolescents about some of the stressors that kids just experience in school these days, whether it's bullying or violence or other unexpected challenges that occur. It's hard to really anticipate all that. All you can do as a parent is create an open door policy where anything that the child wants to bring to you, they can bring it to you in a loving and nurturing way.
Pre-pandemic data from the CDC finds that close to 1 in 10 children between the ages of 3 and 17 had diagnosed anxiety. That's nearly 5.8 million children in the United States. Dr. Malice says anxiety can be healthy, but it can also be really damaging.
It's when that anxiety becomes more significant and starts to really affect lots of different areas in our life, whether it's not being able to be involved in social relationships, struggling completing school tasks, showing behaviors that are really disruptive or problematic. Those behaviors and those emotions can sometimes be really impairing for a child, and when that occurs, that's when you want to call a specialist to get help.
Now, Dr. Malice says there are factors we can try to control that help support good mental health. We're talking about getting restful sleep, nutritious food, being active, having a good sense of self-worth. Keep in mind a couple of resources moving forward. There is a mental health crisis hotline. That is 988 if you feel like you're in a real crisis situation with your kid. There's also a good website. It is aacap.org. So that is the American Academy of Child and Adolescent Psychiatry. There's some good resources on that, aacap.org.